And when Lucy isn't running, cycling and being 4 times Ironman champion, she's promoting the benefits of physical activity for those living with and beyond cancer. We're also really lucky and I'm pleased to have Sarah Mawhinney join us, who is also an impressive 10 times Ironman finisher, passionate park runner and 5K Your Way ambassador. And Sarah's going to be joined by Michael Nielsen, one of our 5K Your Way participants in Shrewsbury. So we've got a great lineup, and I'm going to introduce Steve to the floor to talk us through some research findings.
So, Helen, can you see my slides? Is that okay? Brilliant. Right. So as Helen said, my name's Steve Haake. I'm chair of the Parkrun Research Board. I'm based at the Advanced Wellbeing Research Centre, and I'm part of the Academy of Sport and Physical Activity at Sheffield Hallam University. So what I'd like to do today is just tell you a little bit about a survey that I did with Helen and with another colleague, Alice Bullis, and Parkrun on the health and well-being of parkrun. I'm going to specifically want to talk about those living with and beyond cancer. We did a survey, as we've just seen, so that was the initial page of the survey. And one of the questions was, are your day-to-day activities limited because of a health condition or disability which has lasted or is expected to last at least 12 months? So this we were trying to elicit with any long-term health conditions of our participants. And the answer was no, yes, limited a little, yes, limited a lot, rather not say. So more than 50,000 said no health conditions. And we had 409 who said living with or beyond cancer. And I'll just dive into that a little bit. If someone said yes, then they were then given a list of conditions, one of which was cancer, and then it said, please specify. And so another question would say which cancer it was. If they said no, then they weren't offered any health conditions. But actually, people had the opportunity to write text in a box. And quite a lot of people said, no, I have no health condition, but last year I had cancer, I had chemo, I had treatment, and parkrun did this, that, or the other. So even though people said no, they very clearly had some connection with cancer. So I've got this catch-all living with or beyond cancer to take into account all of those. So 3/4 said yes, cancer, tell me their condition. About a quarter of that number were living beyond cancer. I should also add that there were 20 people who were affected by cancer and whose partner or spouse had cancer or were living with cancer or beyond cancer, and that affected them in some way, and that came out in the text comments as well. But I've not analysed those today, but it was important to say that those people existed in our survey. So these are the kind of conditions that people said they had. So the top one there, breast cancer, 116 people said they were living with or beyond cancer. Sorry, I've used the wrong word on the title up there. Unspecified, people just said I had cancer. 67 people said I had cancer, but didn't say what it was. And then 64 said they had males that said they had prostate cancer. And then the numbers kind of drop off. I'm going to talk about cancer today, but I'll also focus in on breast cancer because they have the largest numbers. So in terms of all cancers, the age of our participants, anyone with no health condition, the average age was about 48. Those living with cancer or beyond cancer, 58 years or more. For those with breast cancer, for women, the age is slightly younger. Parkrun, men tend to be older, women tend to be younger, 46 years, and those living with breast cancer, again, just a little bit older. So those cancer seem to be a little bit older. The number of years registered with parkrun is actually quite long. So the mean is about 3.1 years for people with no health condition, but living with cancer slightly longer, 3.4 years. So it's not weeks, it is years. And in terms of those living with breast cancer, slightly less long, and not that much difference between females with or without breast cancer. If we look at how many parkruns per year they do, those with no health conditions do just under 15. Now that might not sound a lot, but actually that's quite a lot, because a large proportion of parkrunners only do between 1 and 4 parkruns per year. So doing 15 is kind of quite keen. But what's interesting is those living with cancer are even more keen to do parkrun than those with no health conditions. And that's also reflected those with breast cancer. So those with breast cancer living with or beyond are quite active in a parkrun sense compared to females who have no health conditions. This is quite an interesting question about health. Please enter a number in the box below to indicate how your health is today. So that was a question we asked. The score of 0 is the worst health you can possibly imagine. 100 was perfect health. So with no health conditions, people tended to answer, kind of about 80 out of 100. Living with cancer was less than 70. And for those with breast cancer, it was about 72 compared to women where it was 82. So obviously less good health than those with no health conditions. Okay, so let's just talk about those living with or beyond breast cancer. What motivated you to first participate at parkrun as a runner walker? So what we had is we had these as options. People could only select 3. So things like to improve my physical health, to improve my mental health, to manage my health condition, and so on. So let's see what we find. So if we look at just women with no health conditions, what you see by far, main reason for doing it is fitness. 54% say fitness, 34% say physical health, 32% said for a sense of personal achievement, and 20%, 1 in 5 for weight management, and then it goes down from there. So let's look at those living with or beyond breast cancer. The first one, I'm going to start the bottom upwards. The one that jumps out here is that 1/4 of people with living with or beyond breast cancer said that they started parkrun specifically to manage that health condition. Secondly, 16% did it through Couch to 5K. That's about double the average for females with no health condition. And after that, probably the next one, physical health is more important to those with breast cancer. And the rest are all pretty similar, statistically quite similar to people with no health conditions. So now we ask, okay, we know what some reasons for first doing parkrun. What about the impact of parkrun once you've taken part of it, quite often for 3 years or more? So here's the question, thinking about the impact of parkrun on your health and well-being. To what extent has running or walking at parkrun changed? And here's some of these comments: your physical health, your mental health, very similar to the motives question. Now, when people answer these questions, they've given these options: much worse, worse, no impact, better, much better. So we don't want to lead people into any answer. People either answered no impact or better and much better. Very few answered much worse or worse. A few did, and we need to go away and analyse those. But in terms of this analysis, I've focused on better and much better. How many said that it improved their physical health, their mental health, and so on? And you assume that the rest of it is no impact, because this one, the numbers here are too small to get on a graph. So here is our first graph, similar to the motives one. This is women with no health conditions. Sense of personal achievement, 94% said that had improved for them. It's either better or much better, this sense of personal achievement. Fitness, more than 90% said that their fitness had improved. More than 86% said physical health, and so on, all the way down to the bottom, where you get a 50-50 here. Lifestyle and ability to control your weight, roughly about 50-50 of women say that either had no impact or it was improved. And then time you spend with family, right at the bottom, basically had little impact. About 71% said had no impact on the time I spend with my family. So let's look at those with breast cancer. What's really interesting is that, you know, you get almost 100% saying that sense of personal achievement was improved, that fitness has improved, physical health, really high scores up here, and actually higher scores for most of the things. Most of the things have higher scores which are statistically significant, particularly some of these. Time you spend with friends, more than a half said that was improved. Number of new people you meet, almost 70% said that had improved. Ability to be active in a safe environment was higher. Feeling part of a community was higher than those with no health conditions. So really quite interesting about these impacts for people specifically with cancer, in this case, breast cancer. So I'll just leave with you a few of the comments. I said there was a lot of text involved in this survey. So here's a comment from one woman who was living with breast cancer. It kept me motivated to continue running through surgery and treatment. So there's something, it helped her through the actual treatment stage. Another one, just having people cheer on my rubbish times when plodding around with my bald head on show in the summer during chemo made me feel so positive and supported. Here's another one about the future. In remission from breast cancer, parkruns helping in my fight mentally and physically to prevent reoccurrence in the future. And I thought I should just add what one woman said about being affected by her husband having cancer. My husband has a malignant brain tumor, which impacts on my well-being and how I feel about most things. Continuing to do parkrun is helpful as it is so normal. Nobody knows my circumstances, and I find that helpful in managing each day. Oh, sorry, I can't see the words, and an uncertain future. So finishing off, I'll just leave you with what I think are the key messages from this brief analysis. I have to say this is unpeer reviewed. We haven't got this paper ready, but it will be going out at some point in the next 12 months. Those living with or beyond or affected by cancer do actually do parkrun. They exist in the parkrun population. And of course, you're going to hear about that today. Compared to those with no health conditions, people living with cancer tend to be older, registered longer, do more parkruns, but have worse health than those with no health conditions. About a quarter do parkrun to manage their cancer condition. They have similar impacts to the parkrunners, but often with little bit greater proportions. And I'll leave you there. Thank you very much.
Thanks, Steve. That was great. So yeah, I'm going to quickly pass that baton over to Lucy now. And thank you so much, Lucy, for joining us. And I think you're really going to bring some of this research to life now, hopefully with your telling us all about 5K Your Way. So over to you, Lucy.
Hi, thanks for having me. So I have got a Move charity top on, not a 5K Your Way top. But yeah, I am an oncologist. Thanks for inviting me on. And I spend a big chunk of my life on a voluntary basis helping to grow and lead Move charity, which is a very small charity founded by an amazing lady called Gemma, who had cancer when she was 24. And Gemma was a runner and she wasn't given any support to stay active, and she wanted to provide other young people with the support to stay active during her treatment and get back into activity after her treatment that she never received. So Move Charity's got three main aims of work. I'm obviously here to talk about the 5K Your Way Move Against Cancer initiative, which I co-founded 5.5 years ago. Steve, can you just, next slide? Sorry, we've had some technical issues. So Steve's my slide mover. Yeah, so we've got three main arms of work, a very simple but absolutely life-changing online one-to-one cancer rehab program for children and young people living with cancer. Educational resources. So one of the big things we're trying to do is inspire, empower and provide resources that aren't available through the NHS to support anyone affected by cancer to be active. And obviously the 5K Your Way Move Against Cancer initiative. Next slide, please. So my background, for those of you who don't know, is that I used to be a professional athlete, and that triggered my interest in exercise and cancer. But actually, it's a big barrier because people assume I talk about exercise. I try to get people running because I love running myself. But actually, there is a huge amount of evidence that being active is one of the best things that anyone with a cancer diagnosis at any stage can do to help themselves and to make themselves feel better, but potentially also improve how well our cancer treatment works. So I'm not going to go into details, but we do know for sure that exercise, movement, as we like to say at Move Charity, because exercise can be quite intimidating, is the best treatment for cancer fatigue. So cancer fatigue can be utterly overwhelming. It's very different to normal tiredness. I think it's impossible for anyone who's not had cancer to even understand how debilitating it is. And exercise has been proven to be the best treatment for that. We know it reduces depression and anxiety. We know it improves mood. We know it improves physical functioning, and we know it improves health-related quality of life. So those are all facts. But there's actually also accumulating evidence that actually it does a lot more than that. It doesn't just make you feel better and make you feel less tired. There's early evidence that it improves how people respond to their treatment. There's early evidence that it might actually improve how well your treatment works. For lots of cancers, there is now pretty good evidence that being active after your cancer treatment improves survival, reduces the risk of the cancer coming back. And there's some early evidence, not proven, but actually that it might actually improve how well cancer treatments work. So there is science behind the madness. I do have a PhD, but I'm not a scientist, and I believe in the power of storytelling to prove whether something makes a difference. Next slide, please. So 5K Your Way, what are we? We are a supportive community that inspires and empowers people impacted by cancer to live an active and fulfilling lifestyle. So I co-founded it with Gemma 5.5 years ago, and the idea actually came from one young man who I met on the Teenage Cancer Ward. I hadn't treated him. I was still a registrar, an oncology registrar, which is the level below consultant at the time. But he'd been treated for a brain tumour, and he'd theoretically been cured of this brain tumour. But in the process, he'd lost his friends, he'd lost his job, he was spending all night playing computer games, all day asleep, and he'd put on several stone in weight. And I remember walking onto the ward just to give him something, but I can't remember, some paracetamol or something, and walking away, having chatted to him, being so struck by the fact that cancer treatments are improving, that we're curing larger numbers of people with cancer. But actually, what is the point if that's the life that we're leaving them with? So I loved parkrun, and I just had this idea, maybe we could try and get a group of young people who finished their cancer treatment to build up to do a parkrun in 3 months' time. There wasn't much support from the hospital, but I'd heard about Gemma, who founded Move Charity. We had a chat and we thought, do you know what, let's just give it a go and see what happens. And that's how 5K Your Way was born. So at the time, it was just a one-off support group in Nottingham. We had no idea, no plans to expand it any further. And it was really just it just felt intuitive, like it would be a way to combine the physical benefits of exercise, which I knew were there, with the psychological support of a peer support group. Next slide, please. So that was June 2018. And as I say, we just put up some little flyers around the hospital, didn't know who would come. And we've now got, I think, just gone to the next slide. Sorry, Steve. I think we've now got around 90 groups across the UK and Ireland, had our first group in Scotland that launched this weekend in Glasgow. So how does it work? It's so simple, and that's why it does work. Parkrun's there, they do all the work. All we do is turn up. So each group is led by volunteer ambassadors, all of whom have been impacted by cancer in some way. So they vary from people living with cancer, people who've previously had cancer, healthcare professionals, friends and families of people with cancer. So you turn up, you're met by ambassadors, and then you walk, jog, run, cheer or volunteer as much or as little as of the 5K as you want to. I think we've been very pivotal for Park Run in terms of promoting Park Walk. So way before Park Walk, we were there shouting about the benefits of coming, and you don't even have to do the whole 5K, just coming and walking. And then so you do your 5K or your as much of the 5K as you want to, and then go and have a coffee and a chat. It's really simple, but I like to think that it combines being active with the fresh air, with that psychological benefit of being part of a group of people who know what it's like to be on the roller coaster of a cancer journey. Most of the time, I don't think we talk about cancer. Certainly the Nielsen group doesn't talk about cancer. Sometimes they do, but for a lot of people, it's about being around people who get it. And I think one of the things that a lot of people say to me is it gives them back a sense of control. It's a positive date in the diary that's not a hospital appointment. And actually, if as healthcare professionals, we explain the benefits of being active, it's giving people a sense that they're doing something that can help themselves. Next slide. I can't remember where my slides have got to. So I was going to share a video. Steve is an academic. I did do a PhD, but as I said earlier, you do need to do the research to get the funding, but sometimes storytelling is all you need to know that what you're doing is a good thing. The video I was about to show is a lovely lady called Sue who died. But when I come back to my why for what we're doing, I always think of Sue. So Sue was 70 when she was diagnosed with bowel cancer that had spread around her body. And she tells the story of how when she was in hospital, she couldn't even get out of bed. She had never run in her life. And she saw the flyer for 5K Your Way. And she joked with her family and she said, when I get out of here, I'm going to do that. They kind of rolled their eyes and thought, you've never run. This is never going, this is never going to happen. But she did. She turned up and she built up from doing 1K to 2K to running the whole 5K. And she kept doing it all the way through her cancer treatment. And she kept doing it when her cancer treatment stopped working. And sometimes it wasn't 5K, but it was her way. And she had this amazing quote. And she said, when people ask me how I am, I don't talk about the bad stuff. I tell them I've started running. And that's my why for 5K Your Way. But anyway, that's my waffle. We're now going to move on to Sarah and Michael. So Sarah is an ambassador for 5K Your Way. She's been part of 5K Your Way for a long, long time and co-founded the group in Shrewsbury. And Michael is a participant, but an informal ambassador. So they're going to tell you why they think 5K Your Way is a good thing from their perspective. Thank you.
Thank you. Thanks, Lucy. Can you all hear me?
Yeah.
Yeah. So a little bit about me. I was the kid at school that absolutely hated PE as a child. I found school PE quite traumatic, actually. And so I didn't really find the sort of sport I loved until I was in my 40s when I discovered triathlon, partly because my husband started doing it. And then I very quickly got into doing the long distance triathlon. And I was never winning anything, but I was a competitor, and I just loved the whole thing, and that was our lifestyle really. Along the way, I started going to parkrun, and I thought parkrun was absolutely brilliant, but I didn't fully appreciate it, probably because I was always busy training for long distance events and never really had time to just go on and do a 5K. I know that sounds silly, but there we go. Anyway, 4 and a bit years ago, out of the blue, I got diagnosed with breast cancer, just routine mammogram, and it absolutely floored me. I was, I thought the life we had was just over. This lifestyle we had, I just thought, and after the initial shock, I just thought the one thing I wanted to do, I thought, well, I know I need to stay active. That's going to keep me sane. So the first Saturday after my diagnosis, and I was still in shock and I'd hardly told anyone at that point, I went to our park run. And that just did me so much good, because it just made me feel normal. And so I carried on. I thought, right, one thing I'm going to do, I'm going to keep going to park run throughout my diagnosis treatment. And that's exactly what I did. So I had surgery, chemotherapy, radiotherapy, and I'm now on hormone treatment. And parkrun has become such an important part. And it's only since my diagnosis that I think I fully appreciated how wonderful parkrun was, in the sense that it is such a brilliant, inclusive atmosphere, non-judgmental, and actually it doesn't actually matter what time you do. So I also I'd heard about 5K Your Way. I'd heard a podcast or something with Lucy on the year before my diagnosis. So a seed was sown in my head as I was going through treatment, and I thought, you know what, I think we need to get a group going in Shrewsbury. And so after thinking about it a while, I applied to be an ambassador. and we actually formed a group during the pandemic, and then we were itching to get going, which we did, and the group's now 2.5 years old. I think I passionately believe that staying active helped me through my cancer treatment. I used to do a 5K every morning before each of my chemos, and then go off and have my chemo, and then I'd obviously come home, recover, but then gradually build up to running again during each chemo cycle. And I tolerated my chemo pretty well. I mean, chemo's never nice, but I know that I tolerated it probably better than some people did. And I do think being active, you know, played a big part in that. It also, being able to go to parkrun during that time, and thankfully my treatment was just before the pandemic, being able to go there every week gave me a huge sense of normality and taking control of the rubbish situation that I found myself in. So now on the other side of treatment, yes, founded the group, and I'm just so proud of our group. We've got 6 ambassadors in Shrewsbury. 3 of us have had cancer. We've got the others are healthcare professionals, and we've actually got a cancer rehab instructor on board as well now. Well, she's trained as one since becoming an ambassador. We have got genuine friendships now formed within our group, and I think it's really important for people, you know, to have that connection. Like Lucy said, we don't necessarily talk about cancer. We all sorts of conversations. We, you know, but there is that genuine connection between people now. And when I see people arrive at the start of our events, you see, you know, people chatting away perfectly naturally, and you can see it's an important part of their week, month, whatever. And I think it's giving people a big lift to their mental health as well. Yeah, I just think it's absolutely brilliant, to be honest. And Michael, I'm sure, can back me up on all that.
Okay, well, my story is slightly different because I'm not an athlete. I've never been an athlete. Before I got cancer, I was actually retired on ill health because of colitis, and I found parkrun, well, say parkrun, park walk round as best as you could. I think the most powerful thing, it sort of gives you permission to join everyday society. Sadly, I'm part of a family where several people have been affected by cancer, and it's really knocked us back. But what this does is, well, for one thing, it gives me a reason to attend. It gives you permission. When you can barely walk, you feel a bit of a fraud turning up at a park run. But now we've got this wonderful charity. Actually, I'm proud to wear the shirt, and I'm glad, and I tell everybody about it. It's hard to overestimate how much impact it has, because I feel so much better now, and it really is. I mean, I come on once a month, but I come every week now, and it's the big thing for me. I have to do it, because I'm almost worried that if I don't do it, I'll regress back to being ill again. Part 2 of my story is about my younger brother, who has had major surgery, had half of his tongue taken off with cancer, and I'm sure he won't mind me saying it because he's going to listen to this later. He's been pretty down. He wouldn't go out the house. He didn't want people to see him with his scars and everything. And I've been banging on about 5K your way. Anyway, I said, come on. To start with, when I was visiting him in hospital, it was a target to get out of the bed and to the other end of the ward and back. That was the target. And you'd be surprised, over the days and weeks, these little targets motivated him to do it. So last month, he lives near Halifax. Last month, I said, right, I'm going to come up and see. perhaps we can join in parkrun, not knowing that there was going to be a 5K your way there. Actually, it was the very first one. So we turned up to this new parkrun, which is 3.5 laps. I said to Phil, look, perhaps you'll only get to do the half of that. That's fine. They're lovely people, introduced, and they were really nice people, really lovely people. But of course, it's as stubborn as a mule. He did his half lap. They said, perhaps I can do 1.5 laps. You know it's going to end. And he staggered, having hardly left the house for months and months and months. He staggered round 3.5 laps of parkrun, got the most amazing cheer. And it's like he's a different man now. It's like he believes that it is possible to get better. I think that's it. And then you've got people like, so my own story is, I was ill, but I had come across parkrun. When I was well enough to stagger round, I staggered round, I saw this flag. It was a tail walk, and I said, well, what's this all about? And that's Catherine.
Yes.
I met Catherine, and Catherine told me about it, and I thought, oh, great. And it's being part of a community, being welcomed. It's like becoming normal again.
Yes.
Not feeling that, you know, your life is about cancer. Your life isn't about cancer. Cancer is something that's affecting your life, but you've got to live your life.
Yeah.
I'm passionate about it now, and thanks to this lady next to me, she's great. She gets everybody in there. They all love coming. Warm welcome. All the ambassadors. Well, everybody really. I think, as you said, we become friends.
Yes.
I think, like you said as well, it's not talking about cancer all the time. I mean, you can talk about it if you want to talk about it, if there's something, you know, that is relevant. But generally speaking, it's a chance to go have a bit of exercise, meet some friends, go and have a coffee after, and feel normal.
Yeah.
Because that's what that's. And each week, if I'm honest with you, I'm waiting for the next week.
Yeah.
I mean, I've only done a few, and I've done 125 living parkruns now, and I think I'll keep going until I'm in the box.
Yes. I think we all feel like that now, Michael. I think
anyway, I better not bang on. I could go on ages. Everybody I meet, I tell them about it. I'm absolutely 100% convinced that it doesn't have to be cancer, any serious illness. In fact, anybody, you're going to benefit by moving. You're going to benefit by being part of a community, by meeting other people. If you can't run, you can walk. If you can't walk, you can be helped around. You can volunteer. You can just watch. It's great.
Yeah, I just think
the
it's
best thing that's happened.
Yeah, it's a great community, and it's a safe space. 5K Your Way is really a safe space for people who've all been through perhaps a similar experience. Like I say, to connect with each other, and like I say, it doesn't have to be about the cancer, but we've all got that common thread, if you like. And yeah, we just are completely passionate about it, as you can tell.
Well, yeah, I mean, I can't overemphasize. I think for everybody, any person at all, they need to get out there and join in the community, walk around, and you'll love it.
Yeah.
You don't have to have cancer. Anybody can come.
Absolutely. Yes.
Anyway, perhaps we wrap it down. I'm sure.
Thank you so much for that. That's been really lovely to kind of bring it all, into a really heartwarming kind of story at the end. We've had a few questions. Thank you everyone for we've had lots of people introduce themselves on the chat. So we've got a really, from kind of like researchers and professionals and other 5K Your Way addicts, which is great. We've got a real nice group of people in the chat. There's been a couple of questions, which I'm going to kind of fire away. Please do carry on asking questions, and we've got plenty of time to answer them. So I'll go to Steve first, if that's okay. We had a question from Michael, and he, based on the findings that you presented, Steve, do we have an understanding of the socioeconomic or ethnic diversity of the sample you presented? That would be interesting to see whether they were consistent across different social groups.
In terms of the survey, so the survey, we had roughly 60,000 people send in survey returns. In terms of ethnicity, not particularly diverse, overwhelmingly white. So we had a small proportion of people of Black, Asian or other ethnic minorities. In terms of socioeconomic background, if you look at parkrun, and if you were to kind of rank people in terms of social deprivation, there's a score called Index of Multiple Deprivation. So in terms of the least deprived, we have most people, and in terms of the most deprived, we have least people as respondents. So, and it's kind of linear like that. So that reflects parkrun to some extent, but also reflects the people, the kind of people that fill out surveys. So there's two kind of things going on there. But when we account for that, and I've put a link in the chat, there's a paper where we did what you find. We looked at the population as a whole. We looked at people who were least active, who did literally no physical activity prior to joining parkrun. And we looked at people who were from the most deprived communities, and then people who were both the least active and from the most deprived communities. And what was interesting is you find that, yeah, health scores drop down, happiness scores drop down, all those kind of quality of life scores are quite low in comparison to the rest for people who are inactive and from deprived communities. But actually, when it comes to parkrun, it's a bit like those with health conditions. They are more keen on parkrun. Once they latch onto parkrun, they find out that it's part of their lifestyle. So, and in terms of improvements, all sorts of things from volunteering or from running or walking, you tend to see greater improvements from people from those communities. Interestingly, in terms of quality of life, they start off quite low, and although they can come up quite high, improve their quality of life, they kind of never quite reach the average for the population as a whole. So the kind of the main thing you get from that is parkrun can improve the quality of life of people who are inactive and from deprived communities, but it cannot solve all the other social issues that are going on. So people never quite get up to where everyone else is as an average. So there's a paper there, and I'll put a link into a set of virtual papers we also have, all freely available. So if you want to read any of those, you'll find them in the chat.
Thanks, Steve. So another question we had, which seems to be a common question that we've had. I'll ask this to all of you, but maybe Lucy could come in first. How do we support people to come along, whether that's to 5K Your Way or to parkrun, who haven't had like a positive previous experience of exercise? And add on to that, which is maybe a different question, how do we get healthcare professionals to kind of offer advice to those people?
Thank you. Yeah, I think they're both really good questions. Firstly, getting people who've not got experience of exercise down to parkrun, that's a massive challenge. And I think the name parkrun doesn't help, because people assume it's about coming down and running. And this is where I think storytelling is so powerful. And when we started, you know, I guess I've got a background as an athlete. To some extent, that was a barrier because people assumed I was talking about running because I loved it. But the bigger we get, the more we share the stories of people like Sue or Roger, a man who sadly died a couple of weeks ago, but he started walking with his wife, and they initially wanted to get down to 59, which they did. And then he kept volunteering, and then he went back to walking and was taking an hour and 20. But for him, that when Michael, when you were talking about your feelings, how you finished, I could see that pride, that sense of achievement he got when he finished was enormous. So I think sharing the stories of people who aren't runners who enjoy it is really, really powerful. Yeah, I think that's probably the only way, because actually someone banging on about it's good, you need people like Sarah and Michael who have kind of got their own personal experiences And social media can be really powerful as well. But I guess that's why we're with 5K Your Way, and we're really trying to stress that we're not a running club. We encourage walking, jogging. We always put walking first. How do we get healthcare professionals to offer advice? So again, that's really hard. And I think when, going back 5, and I think Helen Crank, I remember meeting you in a few years ago at an exercise symposium in Loughborough. But yeah, going back to the early days when we were kind of founding and growing Move Charity, most healthcare professionals were completely unaware that being active was a really good thing for people with cancer. That is changing slowly, but actually most healthcare professionals aren't active themselves. So if I do a talk to 20 nurses in the hospital about exercise, I'll always say, how many of you exercise for 30 minutes 3 times a week? And it's generally 2 people that put their hands up. So 10% of healthcare professionals exercise, anecdotally, but we're not a particularly active population. So I think the challenge is to how do you get people who aren't active themselves to talk about being active to people who've been diagnosed with cancer? Because actually the natural assumption will be, well, if they've just been diagnosed with cancer, of course they're not going to want to be active. I always think the biggest thing is actually just giving people permission to move, because so often, I don't know if you found that, Sarah and Michael, but when someone is diagnosed with cancer, the natural reaction of people around them is to wrap them in cotton wool and protect them. And actually just giving people permission to do what matters to them, to move and to get fresh air, to go and see their friends is so important. And then you can have that one step further of actually having a conversation about why it's a good thing to be active. And I feel so strongly, people with cancer, generally, when they're diagnosed, they want to do anything that they can do to make themselves feel better and take back control. And there isn't much. If you look at all the cancer websites, all the complementary therapies, there's very little evidence for any of them. But exercise is one thing. There is evidence, and I've kind of summarised that. So I feel so passionately that as healthcare professionals, we have to find a way that to ensure that everyone who's diagnosed with cancer is at least given that information to do what they want with it. Because it's so much better than drinking 3 litres of carrot juice every day, which is what I've seen one patient do. I don't think I answered that question, but anyway, a bit of waffle.
Yeah, but is that the headline? It's better than 3 litres of carrot juice.
But I guess the headline would be we need to challenge the myth that rest is best, because for nearly every person, whatever the stage of their cancer, whatever their exercise background, rest is not best, movement is best. And I think that's the big message. And that's something I think we're trying to change at Move Charity, but something that 5K Your Way is actually doing so well, because the bigger we get, the more people see 5K Your Way Move Against Cancer and think, what is that? And then they talk to someone and they find out that actually there are thousands of people around the country moving their way as much or as little as they want to. And that's a powerful message, I think.
Yeah, it's great. And I think that the evidence, so I'm just drawing on a question we've just had from Stacey as well, who is really interested to know where we can read more about the evidence to support the benefits of physical activity and for people with cancer and going through cancer treatment.
Millen have actually done a really good summary. So I think it's targeted at, well, there's probably one for patients and for healthcare professionals, but it's got links to a lot of the good studies that have been published. So I'm sure we can find that and share that.
Yeah, that's great. And actually, so I'm also an ambassador in Sheffield for 5K Your Way, and I had a lady come along this week who was really worried about fatigue. I mean, she was going through chemo and just extremely tired, and I was, trying to communicate to her that exercise counterintuitively can really benefit your fatigue, but that's really hard to kind of get your head around when you can hardly get out of bed. And she was really interested in what the evidence was saying as well. So I'm just wondering if there's something that we can do to really start to communicate that, because people seem to kind of want that evidence and it written in easy to understand formats. So
I would love to. It's one of my missions for next year is develop some infographics that are spread around the cancer waiting rooms, highlighting that what exercise, like what we mean by exercise, ways that people can do it, but also the benefits that it has. Because I think it's just, I don't know, Sarah and Michael, do you feel that the sentiment that when you're given a diagnosis, you want to know what you can do do you feel that's a fair assessment or fair statement?
Definitely. I was constantly asking them what I could do and when I could do certain things again. And I had very sort of tepid advice, I would say. So in the end, I listened to my body, and because I'd done a lot of triathlon, long distance triathlon, I was good at listening to my body. So I sort of made my own plan going forward, because the healthcare professionals they did err on the side of, oh, take it easy and blah blah blah. And I did at one point actually get told that, you know, if you want to lie on the settee and eat a box of chocolates, then don't feel guilty about that, which I didn't think was good advice, especially when I'd been asking that healthcare professional when I could get back on my bike, basically after surgery. So yeah, I think it's really important that healthcare professionals have the conversation with the patients. They need to find what level that patient's at as well, of course, because we all start, you know, my starting point was different to other people's, obviously. But I think the conversation about exercise should always happen, definitely.
Can I add a little? You see, I think for a lot of people when they get the cancer diagnosis, they are, well, it's overwhelming, isn't it? It's hard to sort of get your head around it at all, or even understand properly what you're being told. If you've got a family member who's willing to go with you to get you started, that's the key thing. See, my Phil that I talked about earlier, he wasn't going to go anywhere. He was going to stay in his house forever, I think. I think with this 5K Your Way, that the next thing is to sort of get volunteers or others or ambassadors to actually say, look, I'll come with you. I'll call around your house. I'll take you there. I'll walk around the course. See, the thing that happened to me, the very first thing that happened to me that was really nice, I mean, I have to say, the first time I could barely walk it. I was worried that I wasn't going to get round because I couldn't walk that far. But what they do at Shrewsbury, and I'm sure they do at other places, is they assign someone to be with you, whatever level you're at, whether you can barely walk, or you can walk quite well, or you need to be supported, or you can run a bit, whatever it is, somebody goes with you. And that's really important. I mean, it's got to the stage now, I've improved so much, I don't really need it.
No.
But I really enjoy it because you go around having a chat with someone.
Yeah.
You know, there might be 2 or 3 of you just jogging along and you're all chatting about this and that. And you feel that really helps.
Yes, it does, yeah.
Because the question was about getting people to that first step, because you can put all the number of leaflets you like, but I can tell you when somebody says you got cancer, you can't even see them. You're just overwhelmed. I think it's a bit like a bereavement. You have to go through stages of coming to terms with the whole thing. I was in an absolute blur, and I needed somebody else to come with me to some of the appointments because I couldn't remember the thing that had been said to me apart from they said cancer, and it's not nice.
No, and we always have. We always at the start of our group, we always sort of work out how many walkers we've got. And we always have a good walking group, but you know, at the back with the tail walker and near the tail walker. And we always, because of the nature of our parkrun course, we carry the flag round with us as well. So it's quite nice. You've got the flag and you've got a little group of people around the flag bearer, if you like. And I always make a point at the start of when we meet and greet people, you know, working out who the walkers are, because they're the ones who, for them, they're taking the biggest leap, if you like. They're people who probably wouldn't have dreamt of going to a park run in the past. And they're the ones actually I'm most proud of probably within our group. And we've got quite a lot of people now who, by their own admittance, would never have thought about coming to park run because of the name probably. And now they've come along and they've had permission to walk with our group. And that's been an absolute eye-opener for them.
They love it.
And they love it.
The thing is, you meet somebody who's terribly hesitant to come, and somebody like Sarah, one of the ambassadors, makes them feel welcome, and then they get round, and you should see their face at the end of it. They light up, and they wow, and they feel, wow, I can do this. When's the next one? Can I have some more of this? No, it's great.
People almost want it more than, I mean, that's the great thing about parkrun, isn't it? I feel like it's that kind of friend that's always there. It's there when you're ready for it. And even when you're going through ups and downs and you're going through those stages like you've just described, it doesn't matter if you can't make it that week, because there's always the next week, there's always the next time, and it accommodates how you're feeling on the day. Like you can walk, you can volunteer if you're not up to walking. There's loads of different ways you can still be involved, or you could just go for the, to cheer people on, or go for the coffee and cake. I mean, there's something for everyone. Steve, did you want to add anything? I noticed you had your hand up.
I did for a short period. It was a previous question about where to find information. There is a book. I'll put a link in. I will put a link in the chat. There's a book called Exercised by Daniel Lieberman. He's kind of a guru. He's called the Barefoot Professor. So he's a Harvard professor, and he's written all sorts of great books about the science of physical activity and rest. And he has a chapter at the end about health conditions, all the different health conditions. And he's got a very specific part about cancer, about the whys and the hows of cancer. It's a relatively expensive book, so maybe go and get it from your library. I'll put a link in the chat about that. And there are some references in the back of that has all these different papers that you can read. But he gives that nice kind of summary about the why and the how.
That's great. Thanks for that. Well, I think I might start to wrap things up. We've had lots of really interesting reflections as well in the chat, so thank you so much for engaging with us. And yeah, thanks so much to our speakers, to Steve, Lucy, Sarah, and Michael. We've really, I think it's been, well, yeah, I always say this, don't I? It's been a great kind of heartwarming session. It really kind of reinforces what we kind of know to be true, I think. I just want to say thank you for our colleague behind the scenes, Rachel Davison, for making this event happen. It's all that stuff that happens in the background that actually gets us here to be able to talk to you today. So thank you so much for that. Like I say, this session has been recorded and it will be available afterwards, and we'll circulate that. And I'm just going to add a link in the chat so you can see our other seminars. Oh, Rachel's also done it. So yeah, feel free to have a look at the previous discussions that we've had, because they've all been kind of really eye-opening, and I mean, yeah, they're great. Have a look at them. So thank you all for joining us. Thank you for engaging with us and asking questions. Thanks again to all our speakers, and we will see you all next time.
Thank you.
Thank you all.